Liver transplant, a surgery that most of the patients feel really afraid of. Liver transplant, a surgery which is considered one of the most complicated surgeries around the world. Hi, I am Dr. Saurabh Singhal. I am the Director and Head of Liver Transplant, Robotic Hepatobiliary Surgery and GI Surgery at Aakash Healthcare, Dwarka, New Delhi. So friends, I'm going to talk about liver transplant, but more specifically, the liver donor surgery. See, the liver transplant is done in two ways, either a living donor liver transplant or a cadaveric liver transplant, also known as deceased donor liver transplant. Now, especially in North India and many of the Asian regions where we have a severe paucity of organs through the cadaver organ donation, the living donor liver transplant has recently advanced as the most common type of liver transplant being done. In addition, we have several advantages because we are able to get a better quality of liver, which definitely helps the recipient, and that has added to the survival in these patients who are actually sick with the complete liver failure. So whenever we talk about the living donor liver transplant, the biggest question, the most important question that every patient asks me is about the safety of donor. And as a human being, as a person, and as somebody whose family might ever be in that scenario, I will always have such questions if I am the patient attendant or if I am the donor myself. So today I'm going to talk to you about the donor safety, about the living donor procedure, and I'm also going to explain to you how with the newer technologies in the current medical scenario, the living donor liver transplant has become a very, very safe surgery, and even safer than some of the common surgeries that are being done in these days. So talking about the living donor liver transplant, the surgery is done when there is a donor and there is a recipient. Both the surgeries are done together, where the healthy, willing donor who has been examined, who has been investigated, and has been found to be a fit donor, donates a part of his liver, which is then transplanted into the recipient in place of his diseased liver. So the living donor surgery is either done by an open approach or by a minimally invasive approach, and the minimally invasive approaches can be either a laparoscopic surgery or a robotic surgery. Either of these minimally invasive approaches have the advantage of very fast recovery, very less pain, and almost scarless surgery. So the patient does not end up having any kind of scar on his abdomen, on his tummy, as compared with an open surgery where there is approximately 10 to 15 centimeter of surgical scar, which is there. Although as a surgeon, we always try to keep this scar, this surgical incision, as small as possible, and always try to do subcuticular suturing so that the patient's scar looks absolutely minimal and does not give a very bad scar to the patient. Whenever we talk about the surgical part where we split the liver is composed of two main parts, that is called as left lobe and the right lobe. The left lobe comprises of approximately 40 to 45% of the liver, while the right lobe comprises of approximately 55 to 60% of the liver. So whenever we do the surgery, we either take the left lobe or the right lobe. The most important thing for a donor to know is that our liver has so much of reserve that even a 70 to 75% of the removal of the liver can still be viable with the life. So taking out even the right lobe, where we are taking out almost 55 to 60% of the liver, does not cause any liver failure to the donor. In the prior tests that we do, including the CT scan and the MRI, we see in detail about the size of the liver, the shape of the liver, as well as what are the volumes, what are the approximate predicted size of the left lobe and right lobe, so that we can predict that even if we take the right lobe, the patient is not going to have a problem. Whenever we talk about the donor surgery, the most important dictum for a liver transplant surgeon is donor safety first. At no stage, at no position, we ever compromise with the safety of the donor for the benefit of the recipient. If during the prior tests, during the evaluation of the donor, if we find that anything, even a small thing, which can possibly even remotely be difficult or can be a risk to the donor, we tend to reject that donor, and we ask the family for another donor. Same way, if during the surgery also, although it almost never happens, but during the surgery also, if we find that finishing the surgery, the completion of the surgery can put the donor at risk, we will abandon the surgery. We will not proceed with the surgery, but at no cost we will ever let a donor get compromised or have any risks whatsoever. Whenever we do the surgery, after the right lobe is taken or the left lobe is taken, the donor is completely evaluated by a senior surgeon to make sure that before we close the donor up, before shifting them to the ICU, we make sure that there is absolutely no bleeding or no signs of any possible risk or complications which a donor can have after the surgery during the post-operative period. These donors, when they give a part of their liver, that liver which is taken is put in the recipient's body. The rest of the liver which is there in their body is going to grow over the period of next 6 to 8 weeks. Initially, the growth of the liver is very fast. Almost 40 to 50% of the growth happens within a period of a week, and almost 95 to 99% of the growth happens in a period of approximately 4 to 6 weeks to up to 8 weeks. So by 8 weeks, the donor has almost the same amount of liver which he used to have. So that is the reason a donor is not supposed to have any precautions, any restrictions in their meals. There is no need to take any medication. There is no need to do any tests after initial period of 2 to 3 weeks. These donors can continue to live the normal life, and after a period of 6 to 8 weeks, they can even start going to gym, start going to swimming, they can start going for hiking and do whatever they want, and they do not have any compromise in the quality of life. One newer thing is that we are able to do robotic donor hepatectomy as well these days. In the robotic donor hepatectomy, there are only small keyholes that are made on the abdomen, which are hardly visible after the surgery, while the liver is taken out of the body through an incision which is hidden under the undergarments. So these patients do not have any scar, and they also have very less pain, so these patients recover very fast. So robotic surgery is the newer advancement that few of the centers are using, and we are very proud that our center is able to provide that option of robotic donor hepatectomy in these patients. So if you have any questions regarding the robotic donor hepatectomy, the overall donor surgery, or any risks involved, or any questions regarding how the life is going to be after the donor surgery, you are welcome to contact me, our hospital, our team, and we'll be happy to answer all of your questions.